Hello everyone, today I'm going to talk about myocardial infarction, acute myocardial infarction. Acute myocardial infarction refers to the irreversible necrosis of heart muscle to a prolonged ischemia, usually due to coronary artery occlusion. Acute myocardial infarction is one of the principal causes of death in all around the world. The most common mechanism is a rupture of atherosclerotic plaque in a coronary artery. This leads to platelet accumulation, and thrombus formation, and obstruction of blood flow to the myocardium. The clinical presentation of this disease is chest pain and discomfort. The pain may radiate to the arm, to the left arm, the jaw, the neck, and is frequently accompanied by shortness of breath, sweating, or nausea. For the diagnosis, we have three key elements. That is the clinical symptoms, the change in the electrocardiogram, and the biomarkers like troponins. The diagnosis is based on three pillars. That is typical clinical symptoms, characteristics in the ECG, and the elevation of your markers. The most important thing for the diagnosis is elevation of the ESD segment in the electrocardiogram. We have two types of myocardial infarction. We have the STEMI and non-STEMI. STEMI means ESD elevation myocardial infarction, and STEMI means non-ESD elevation myocardial infarction. STEMI is more important because it requires immediately reperfusion therapy, and non-STEMI is managed based on the risk stratification. The initial treatment is morphine, oxygen, and nitrites, and aspirin. And the definitive treatment is percutaneous coronary intervention. And if that are not available, and we can use thrombolysis, but percutaneous coronary intervention is preferred treatment. We need in this patient a long-term management. The long-term management, the objective of the long-term management is to have more quality of life. Well, for the long-term management, we use the dual antiplatelet therapy with medications like aspirin or clopidogrel, and we use beta blockers like propranolol, metoprolol. We use ACE inhibitors like captopril and enalapril, and we use statins like atorvastatin, pravastatin, and of course lifestyle modification. Well, in summary, acute myocardial infarction is a time-sensitive emergency. Early diagnosis and prompt intervention are critical to reduce the mortality and improving outcomes. Thank you for watching.